Pasha, thanks so much for taking the time to speak with us. Tell us a little bit about your background and what you do for a living.
Hi, Allison. Thank you for having me. So I've worked for the past 15 years for the Human Research Program as a contractor at the Johnson Space Center. And I have a team, and we develop medical research protocols or integrate them for astronauts that go to the space station. And some of the experiments that we support are actually immune studies. So we've looked at how the immune system is affected by spaceflight, and it's a little bit relevant today for what we're experiencing in the bar industry now. So I have a bar in the same neighborhood close to where I grew up, just a couple miles down from Johnson Space Center. And we've been struggling since the start of the pandemic. We were shut down initially, then we opened up in a limited capacity for to-go. Now we can sell cocktails to go, as well as have people outside and even inside in a limited capacity, as long as we sell food. And it's just been a struggle to try and manage the risks of the pandemic while keeping all of my staff employed and paying the bills and making sure that we survive and get through this safely.
You know, talking about your bar in the hospitality industry, what happened when the pandemic really hit here in Texas? How was your bar and the other business owners that you work with and vendors and contractors, how was your industry affected by this COVID-19 pandemic?
In my bar, we shut down for a couple weeks, but my partner and I had been saving up cash for a couple of years so we could expand into a next door space that opened up. And so what we did, we closed down completely for about a month before we started selling juice to go. But we burned through our cash so that we could make sure that we kept paying our employees a living wage and to maintain their health insurance. But we are in the minority. There are countless bartenders that I know that were out of work, and there's a ripple effect. So when this industry is shut down, the people that I buy products from also lose money, and those employees get affected. So the company that I buy my fresh produce from, the liquor companies that I buy, or the liquor stores that I buy alcohol from, they all started having to lay off employees as well. I think I have a network of probably 150 people locally in the city of Houston, and I can only think of a couple of them that haven't been either laid off or had their hours severely restricted because of the nature of hospitality work. It is completely dependent on face-to-face interactions, even if you're wearing a mask.
And so for you, and also really with some of your colleagues, your staff and employees, what sort of emotions, what were your feelings whenever we've had that first wave of closures and then reopening and closures again? And because, I mean, this is real life. This is something that we have to deal with every day. And I can imagine that it can take quite a toll.
It's emotionally exhausting. It's exhausting. It's hard for everybody when we shut down, because immediately, I as the owner, but more importantly, my staff who depend on their paychecks to pay their rent, to pay their car note, to buy groceries, to cover their medical expenses. They don't know if they're going to get where the next paycheck's going to come from, and so it's terrifying, quite frankly. We didn't know how long the closure was going to last, and there are a lot of bar owners that I've seen in Texas that use the same thing that I said. They say that the shutdowns are an existential threat to the bar industry, therefore they should not happen, period. And I understand that instinct because they're terrified. They want to pay their bills. At the same time, though, I also realize that if people are dying of COVID or if they're getting crippled by COVID, they maybe can't come spend money at my bar. So I want to do what I can to protect public health. And but the fits and starts have been really challenging because we were closed for a month, and then we were allowed to open up for to-go sales. And even there was a point in June when bars were allowed to open completely, I think to 50 or 75% capacity. We chose to stay closed because we had a good to-go business model that we had readapted to. But I think that we've had to shift, we've had to pivot. Pivot's a word that's very popular nowadays in the bar industry. We've had to pivot 5 or 6 times over the past 9 months, and it's exhausting. There are days that you just cry. You worry about yourself, but you also worry about your employees, the people who depend on you, and that's I hate it. I hate it. I hate it. I hate the uncertainty. I hate my staff worrying about whether or not they can pay their bills, and so I cannot wait for the vaccines to roll out. I cannot wait to return to a sense of normalcy when my staff just showing up to earn a living doesn't necessarily mean that they have an extra risk of getting a disease that could cripple them for life.
Yeah, absolutely. And in public health and really our greatest scientific minds have been working to try to understand this novel coronavirus and find out ways that we can get protected from it. And some of the best tools we have are simple things like wearing a mask, good hand washing or hand sanitizer if soap isn't available, and keeping a physical distance of at least 6 feet. Well, thank you so much, Pasha. And you bring up a lot of really, really important points. And, one thing that I would want to emphasize with our Texas policymakers and also their constituents is that we've all really felt a lot of hurt from the coronavirus pandemic and some of the closures that have happened because we're trying to mitigate the spread of the disease. But we really need a real solution, and that these are just been some sort of stopgap measures to close to try to mitigate some of the spread. But one thing that we would really like to see is getting a coronavirus vaccine that's available to everyone, and that we really need to address some of the root causes of our economic slowdown because of the coronavirus to make sure that we do have a really strong public health infrastructure, that everyone who is recommended to receive all of their vaccines has access to those vaccines and that they can get them, so that we can really get our Texas economy back up and running as quickly as possible. I invite our listeners today to subscribe to our channel or to follow us on social media or our website at immunizeusa.org.